Sorry po, sandali lang po. CR lang po. Sorry. Okay. Sana ba tayo? Okay. Sana ba tayo? May mga question kayo? Any questions?
Wala na, ma'am.
Sana ba ako? Kasi how she preserve. Hygiene. Now we are, I think we have here in a food handling. Now we have here in food handling, we have to be very careful with our personal hygiene. We have to wash our hands frequently, especially when we go to the toilet or we handle for something that which is not hygienic. So we have to wear also some clothes like clothes appropriate para sa when we are having handling food, and also you have to wear cap. Maybe yung sa hair mo baka may ma-fall pa na hair na makasama sa food, and also you have to wear your mask and gloves. Be careful that the hygiene instrument is used is an instrument in working continuously. What happened now? This one. Okay. What happened? Alam na nangyari. I don't know what happened with my...
Ano yan, ma'am?
Nawala na. Ayun. May mga ganyan-ganyan. Pag gusto ko mawala ito. Okay. Now, we have a healthy lifestyle. We have to be very careful with our health. Ibang lahi ito lifestyle. We have to do our daily portion. We have to eat healthy foods, and we have to do our daily activities. We go for work, we go for studies, jogging, or everything that for daily activities, and we should take care of our health and hygienes. The most important thing in health in food and nutrition is that we have to take 1 minute. We have to take the right food for us, and for feeding and nutrition we have to take the proper foods, always the healthy food, so that we have a good healthy body. Always remember that the food that we take or we ingest food is who we are and what we are, and because if we take good food for us, it will prolong our life and we have a good body. But if we are not taking the right food for ourselves, uh, we may lead to illness, and even we become unhealthy. So we have to take care for ourselves. So we have to feed what is well balanced for our body, and we have to remember that we need foods, um, the foods that can give us good life. Like for example, the food wheel. We have to remember that body regulates food. We need fruits and vegetables in our body for us to live, can prolong life. We need also a bodybuilding like the protein, minerals, which like for the fish, the carbohydrate, the fish, the meat, and also the energy producing, like for example, the bread, the yogurt, pasta in our life. And when we are not taking care of our lives, it can cause also for us for a disorder, even obesity. The number one problem for the nutrition is that obesity. We become fat because of too much ingestion of food of our body. But we may also become anorexic because of we are too much conscious of the food that we are going to eat. We're not able to eat. So we take uh, we will not take or ingest food. Or the other thing is that the bulimia. We eat too much food, and then after a while, just to give ourselves, and then we purge. Yung bang parang we purge also the food that we eat. So that is the disorder for the food and nutrition. And also we have to be very careful in preserving our food. If we need to preserve the food by the process of cold, heat, by cold, by refrigeration, freezing, and deep freezing, and heat, also by sterilization. Also, you have to preserve the food by dehydration, by drying, concentration, or lipofuscilization, or some additives like a natural one, like smoke, or salted one. You could do also artificial food preserving, like coloring, antioxidant, physical characteristics, sweetener, flavor enhancer, or preservation also. Very important for the food is that the name of the food, the ingredient must be listed one, and also the expiry date is there, and special preserving, how you preserve the food that you are going to eat, and the nutritional information, how many like for example, how many calorie, or the calorie, the lipids, or anything that is written there, and how you use the information. So that is very important for the labeling, because there are some food that there is no label, and sometimes it can cause also uh, when we ingest, it can cause us for an illness. Now, um, I did not put it anymore for something, but the thing is that we have to always do our daily activities, our portion. We have to take food for us, daily uh, health and hygiene, and that's all. Now we are going to specimen collection already. One minute. Now, in a specimen, when we are in the hospital, um, usually we give blood, we give our stool, our urine, and we should know things for that how you do it that one. So, nurses assume that the responsibility of specimen collection, or even not nurses, even we are also doing it now, especially when you are also working at home, like you have patient and you bring patient from the hospital. Number one, for the specimen consistent, you have to collect the urine, you have to collect the stool, you have to collect the sputum. Sputum is that yung when you cough and then there is a productive cough like that, or any fluids that coming out from the mouth of the patient, that is the sputum. And also the wound drainage, if there is any drainage for the patient that you need to investigate, and also for the blood. Now, it is very important that we have to take care for the patient comfort when we have to collect from them specimen. We have to check them. We have to very careful for them. You have to check for the privacy of the patient, and you have to ask questions if they are okay, if they are fearful, or you made the patient comfortable, and you have to be very clear and concise direction. When you say direction for the patient, it must be very clear. If they do not understand you, you have to repeat it again. And always tell to the patient when they have this collection of specimen, they must be NPO, meaning to say NPO, nothing per orem. Okay? Nothing per orem. Isn't it we study for that one in the medication, NPO?
NPO.
Hello? I am clear?
NPO, ma'am.
Ano po ibig sabihin, ma'am, ng NPO?
NPO?
Nothing per
Orem.
oren?
Meaning to say
Okay.
nothing orem. Meaning to say nothing per mouth. Nothing per mouth. Meaning to say you have to fast.
Tanong ako, nagbasa kasi siya ng... Ay, sorry.
Pag pumunta ka sa hospital, it is better to have this you are fasting, you did not eat. NPO, meaning to say you are fasting, you did not take from the mouth. But the medical term for NPO is nothing per orem. I think we discussed that one in medication. Any question? Just stop me if there's anything. Now for the nursing aid, because usually nursing aid, you are working in the hospital. So sometimes, most of the time, the nurses cannot do everything already. So they entrusted to the nursing aid to do for some specimen sample. So when the nurse check for the physical order of the patient, they will entrust something to the nursing aid. So when you're instructing the patient, you keep it very simple. Any direction, you have to keep it simple, understandable, and direct to the part. We have also, in checking for the, or getting for the specimen of the patient, you have to observe standard precaution for the patient. Like for example, you have to wear mask, you have to wear gloves, you have to yourself safe, because you don't know the person like that. Okay, and then every specimen that you take from the patient, there must be a label. meaning to say what is there is the name of the patient there. There is a file of the patient, because you know, if you will not able to label that container or that blood, there will be a problem. There will be a mismatch or interchange of the specimen. So you have to put it the label of that one, and also the time. You have to put the time for the patient for that one, because some tests, there is a time limit for that one. Maybe when you give specimen for the patient, it's already expired. So meaning for 2 hours only, the specimen of the patient may expire. So it's better to, you put that time, you have to label, you put that time. And also when you check for the culture and sensitivity test of the patient, you put the specimen for in the refrigeration. Why? Why you put in the refrigeration? Because when you are checking the culture and sensitivity test, the fungi may only live in a cool place. So if you do not put in the refrigerator at any time, the fungi may or the specimen that you will not able you will collect it from the skin of the patient or from any patient that you have taken the specimen, the microorganism die already. So you put immediately in refrigerator. So all things that you have collected from the patient, you have to put it documented. Everything is documented. Okay? Any question? Nothing? Okay. Now, in taking the urine specimen of the patient, there is a random. It must be a clean container for the patient. It is clean. And if the patient have menses, you have to take down notes, because you know when we take specimen and become red, maybe they think there is a blood. Or sometimes when we eat, you know this beirut, the red one, I forget the name, the red one that in salad that they are putting. We have one patient that when he ate this food, and then when he passed urine, he's suddenly very fearful, and then to tell him why my urine is like pink getting red like that. And then we asked for that one, we interview him, and then he remember he ate that food. The one, it's the red one in salad that they are putting. Beirut ba yun? Beirut? Yung red na
Beetroot,
hard.
ma'am. Beetroot.
Beetroot. Eat this beetroot, and then everyone the patient is very scared to give that sample, because
Nagre-red talaga yan, ma'am.
nagre-red. Why my urine is red like that? So you have to take down notes. The patient eat beetroot, or the patient, if it's female, have this period. You have to take down notes for that one, because some patient doesn't know, or if they have this mens, they didn't want to give this urine sample. And when you are testing for specific gravity or the pH of the patient, or albumin or any sugar or glucose in the urine, also that is the purpose also. So in urine specimen, you have the random. It must be clean. The patient, if he have mens or he eats something, you have to take down notes. And for urine specimen, we are testing for the specific gravity of the urine. The pH is either be acidic or alkaline. Albumin, if there is a presence of albumin or glucose, or any crystal or any culture like bacteria growing, or any sensitivity with antibiotics, so that the patient could be given right antibiotics for them. And then the reading is after 24 hours. There are some tests for the urine, that is test for 24 hours, test for 48 hours, and test for 72 hours. Now, in getting specimen for the urine, it must be in a midstream urines. It must be sterile. Catheters specimen also never get from the bag. Pag kumuha kayo ng ihi if you get urine for the patient, it must be in a clean, sterile one. And it must be in the midstream. Pag sa normal one, midstream ang paganahan. You have to pass little bit, and then in the middle, you have to collect for the urine. That is the right way of getting urine samples. And for the catheter also, you take also for the midstream. You pass a little bit, and then after that, you open the catheter. The specimen never take from the bag. Okay. Now, we're finished already. Why urine specimen is for culture and sensitivity? Usually we do this one for the patient who have the problem of urinary tract infection. If there is a frequency of urination, urgency of urination, dysuria, hematuria, flack pain, fever, and cloudrous or malodorous urine. Usually this one, urinary tract infection, all these characteristics you could see with the patient with diabetic patient. All these characteristics they have it. But for UTI, also like this. Now, obtaining a specimen for this one, when you go to the room of the patient, first you have to wash your hands. You have to clean the meatus of the patient, and then from the female front to back, you start from the stream, then stop, collect the specimen. You have to use aseptic technique. Get the bedpan or Mexican hat, and then after you obtain the specimen, the urine specimen, you bring the lab in 15 to 20 minutes post collection. It must not be delayed. It is better to have this fresh one. Now for children, actually this one, how to clean, you have to clean yung pinaka-pepe ng pasyente. You have to clean first the vagina for the patient, the opening for the uterus of, for the urinary of the patient. And you have to clean from front to back, from the cleanest one to back, okay? And
Ma'am, excuse.
Apo.
Ako po magpapaalam muna po ha. Ako po tinawagan ha. Okay po.
Sige, okay. Mag-ano ka na lang, mag-follow ka na lang sa mga ano natin. Ano nung pangalan to? Topics natin.
Opo.
Okay. And then mag-start ka from the top to bottom, tapos using with aseptic technique. In pediatric bags or the U-bag, eto siya. This is how it look like. Never squeeze the diaper of the patient when you also collecting urine. Never squeeze it. Now, there are the characteristics of the urine. You have to check for the color, if it's clarity, if it's clear or cloudy, and the odor you have to check. These three, the color, the clarity, and the odor. And then for specimen collection, also at random specimen, it must be clean, not sterile. Order for urine analysis for testing, measurement for specific gravity, pH, and glucose level. Now, for urine specimen collection, midstream, it must be midstream specimen. It must be a clean, voided, for culture and sensitivity test, and for 30 to 60 ml of urine. When you collect, you have to collect 30 to 60 ml. And then, Number 3 is that it must be a sterile specimen indwelling catheter or in the drainage bag. Also, the time for the urine specimen is between 2 to 72 hours interval. 24 hours is the most one. You have to begin after urinating, and then note the start or the container requisition. You have to collect all urine in time period and pause reminder sign. Now for indwelling catheter, you have to use strict aseptic technique. Only for bag, if brand new, if sample port, you have to clamp in 30 minutes prior, and then you have to wash the hands, you wear the gloves, cleanse port with alcohol swab, and then sterile needle. And then after you collect it, you bring it to lab 30 minutes, at least 30 minutes, may refrigerated for 2 hours. For the common urine laboratory test, there is a routine urinalysis. You have to examine within 2 hours the first voided specimen in the morning. The reagent strips also. You have to check the specific gravity, the concentration, and the urine glucose. Now, in measuring for chemical properties of the urine, if urine analysis, if there is a presence of glucose, if there is a presence of ketones, protein, hematuria, and the pH, if whether it's acidic or alkaline, or the specific gravity is too high or too low, or there is a microscopic examination, meaning to say there is a blood or there is some crystals found in the urine. Now, when in stool specimen, also the analysis of fecal material can detect pathological condition. Example, there is a tumor, there's a hemorrhage, there is an infection.
Don't put in your mouth.
In test, there is also for the OB, for the PAS, OPA, and parasites.
Okay,
Ito siya, yung collect on plastic wrap and transfer vial as the liquid reaches to fill the
What's
line.
this?
Ito siya. And to remove the spoon from the and discard.
This one.
Replace the cup and vial tightly and shake
I like this water,
in the until it's ready to ship. Now, for fecal specimen, meaning to say yung stool niya, there is for a chemical preservative, there is a medical aseptic technique also. To laboratory, it must be on time. The labeling must be also considered, and documentation. There is a GIAC test for the colorectal cancer screening test. Yun yung GIAC test. For fecal characteristic, you have to check for the color. If there is melena meaning to say there is a blood in the fecal or in the feces. You have to check for the odor, the consistency, the frequency, the amount, and the shape. The GIAC test is a single positive test result does not confirm when there is a bleeding or colorectal cancer. This GIAC test must be repeated 3 times. And the patient must be meat-free with high residue diet. And also for vaginal or uteral discharge specimen. Normally, it's thin and non-purulent whitish or clear small amount. Also, this one we use for the signs and symptoms of STDs or sexually transmitted disease or UTI. This is not delegated. You have to access the external genitalia. If it's STD or record sex, you have to interview them if they have the multiple partners or what job they are, or physical order, physician's order like vaginal or intrauteral, how to get the discharge. It's either in vaginal or uteral. And for blood specimen also, there are some lab tech who are taking lab test and the ABG and blood glucose. Now, also, in getting specimen for cerebrospinal fluid. They have to inject in your spine and just to get the spinal fluid, the cerebrospinal fluid, actually in the spine mo mismo. Ganyan. Now, in respiratory tract also, in taking a specimen for that one, there is a test to determine abnormal cell or infection. There is a throat culture. There is a sputum specimen also. There is a skin testing also. There is a thoracentesis. Now, for the nose and throat specimen, this is for upper respiratory or throat infection. This should not be delegated. You are the one who will do it. So the throat swab also, this one done before meal or 1 hour prior to meal, and then you have to wash also your hands and you have to wear gloves, tilt the head backward, and you tell the patient the pharynx are not visualized and tongue depressor anteriorly. So 1/3 of the tongue also. So you have to tell them if they tell you could get the good specimen, best specimen for that one. For the throat culture, you have to check for the oropharynx or the tonsillar, stereo swab. The culture determines the pathogenic or microorganism. Sensitivity determines the antibiotic to which the microorganism are sensitive or resident. The method for throat culture, you have to insert swab into the pharyngeal regions. There is a redness area, or if there is an exudate. The gag reflex if the patient is in sitting or in leaning forward slightly. You have to inform the client to reprocedure for this procedure. For the nose culture, you have to let the patient blow their nose, check their nostril patency. You have to rotate the swab, inflame mucus, or there is any exudate. Swab test must be advanced into the nasopharynx to ensure the culture is properly obtained. Usually the nose culture is the one most we are doing today for the COVID test. So this is where it falls, the nose culture. Now, we have also sputum specimen. There are 3 types of major types. In order to identify the organism growing in the sputum, you have to check for the test for culture sensitivity test, the fasting culture, which is consecutively for early in the morning, you have done for this one. The other thing is cytology, abnormal lung cancer by cell type. You have to get the specimen at 3 a.m. You have to take it early. And also maybe delegate. You can maybe delegate. You could tell also this one to yung kasama niya sa or the companion of the patient. Cough effectively, mucus from the bronchus, not saliva. You have to let the patient cough effectively and collect mucus from the bronchus, not saliva. You have to record also the color, consistency, and the amount of the sputum. The sputum collected, no mouthwash. The patient should not use mouthwash. Toothpaste, viable of microorganism to alter the culture result. So when you are collecting the sputum, you instruct the patient that do not use mouthwash or toothpaste because it may trigger the microorganism and alter the culture result test. Now, for the skin testing, it determines the pulmonary disease, which is the bacterial, fungal, and the viral. And there is also the antigenic inject in the terminal injection site must be circle. Instruction not to wash the site. And intraduration palpable elevated hardening area around the site, edema. To do this skin testing, we are testing for bacteria, fungal, or viral. And then the antigen is, you put it intradermally and the injection site must be circle. Instruct the patient not to wash, because if she wash, you may miss already, and the reading is wrong already. You have to, there is an induration, it's palpable, hardening area around the site, edema, inflammation, antigen, antibiotic reaction, measure in millimeters. So if once they have to, you have to wait for 30 minutes, and then after that, if you see there is an elevation, hardening around the site, edema, or there is a redness like that, so the patient is positive. If the redness is flat, the patient is negative. So if you see something on the skin test become elevated, become inflamed like that, it's positive. But if the once that the circle is in that area, and that area did not become big, or it's flat, the result is negative. The elderly frequently display false negative, or also the skin test is for the TB skin test. If positive for TB skin test, you have completely take the history of the patient, complete history, risk factor, the symptoms, if there's any weight loss, if there is night sweating, if there is hemoptysis, meaning to say the patient is coughing out blood, and then the patient is frequently fatigued, and you have to check, get the sample at early morning, the sputum for fasting, and you have to check for the chest X-ray. For the thoracentesis, they have to insert the needle in chest wall into a pleural space. They have to aspirate fluid. This test, they have to diagnose the patient, to give the therapeutic medication, and also they have to give for biopsy. This is ito yung abdominal parenthesis, when they are taking a fluid also into your abdominal paracentesis. Also, is in nasogastric tube. Now in cultures, there is a culturette swab, there is a wet and dry method, the nose and throat and wound. You have to review the procedure manual to fill the requisitions also. For nursing function for the specimen collection, you have to explain the procedure for the patient. You have to gain the client participation, because if you will not able to gain the client participation, you will not able to gain the right specimen, and the result of the test will be not correct. And you have to collect the right amount of that specimen, may it be urine, your blood, feces, or anything. Must be in the right amount of the specimen at the right time. Do not delay it. Always do it. But once you do it, you bring it immediately to the laboratory. You have to place the specimen in a correct container. It must be, there are some which is ordinary, or some which is sterile.